my audience. Here we go.
Registered nurses, RNs, are required to complete at least 2 years of formal education and obtain a state license in order to work in a nursing capacity. Although the healthcare industry is changing, the Bureau of Labor Statistics predicted a growth of 16% in this profession for the 2014 to 2024 decade. The average annual wage for registered nurses was $71,000 as of 2015. Registered nurses often work in hospitals or outpatient facilities where they provide hands-on care to patients by administering medications, managing intravenous lines, observing and monitoring patients' conditions, maintaining records, and communicating with doctors. They are also relied upon to give direction and supervision to nurse aides and home health aides. Beyond the physical support and care they provide, registered nurses may provide emotional support to patients and family members, educate patients and the general public on disease management, special diet plans and medical conditions, provide information on home care after treatment, and teach individuals how to self-administer medication or complete other self-care tasks. Nurses employed by physician offices and other types of facilities may have different duties depending on the level and type of care being offered. An aspiring nurse's first responsibility is to look ahead in this broad profession and decide on the right educational track. An associate degree takes 2 years to complete, whereas a bachelor's degree takes 4 years and includes additional clinical training experience in non-hospital settings. Nurses who wish to enter into administration, research, consulting, or teaching positions may wish to pursue accelerated master's degrees in nursing, which can be combined with the pursuit of the Bachelor's of Science in Nursing credential. Once they have earned the desired degree, individuals must pass the NCLEX-RN, a national licensing exam. From there, RNs can proactively manage their path through this profession by pursuing specialties based on a certain type of patient, a certain category of illness, or a specific type of facility, such as an imaging facility, emergency room, or cancer treatment center. While all nurses are responsible in some form for the care, comfort, and well-being of patients, their overall responsibilities will differ widely depending on the direction they choose. According to the 2014 reports of the U.S. Bureau of Labor Statistics, BLS, nurses may work in hospitals, home health care clinics, private physician offices, nursing care facilities, and government. Hospital or urgent care nurses may be required to work evenings, weekend, and holiday shifts, since most facilities of that type are open 24 hours a day, every day of the year. In some cases, nurses are on call and must be ready to work on short notice. A nurse in a physician's office, however, may have a more standard schedule. Registered nurses sometimes run clinics or conduct educational seminars or blood drives. A nurse in a physician's office, however, may have a more standard schedule.
All right. Who are the people that take care of us? I have had an interest in being a nurse since I was in high school, and I even pursued a career in my high school with nursing. I took a biomed class for my 4 years of high school, and what I'm going to talk about today is what is an RN, what does it take to be an RN, and what is the daily life of an RN. I'm going to tell you the basics of what an RN does. And according to the registered nurse that I interviewed in pediatrics, her name is Catherine Nunez, the RN I interviewed. She said that basically there are different types of registered nurses, ranging from pediatrics to emergency, cardiac. There are different locations and specialties. You could work anywhere from an office to a hospital, a school. There are also different specialties that you kind of focus in. So responsibilities for a registered nurse varies, but most of it consists of administering medicine, looking at medical records, talking to doctors, informing patients of what their medicine or care would be, Where you can work is, once again, clinicals, hospitals, schools, homes, if you're, hired for that thing. Following the description of the steps taken to be one are the courses in education. If you are getting an associate's in nursing, which is 2 years, or a Bachelor of Science in Nursing, which is 4 years, which is what I'm doing now. Certifications for nursing are passing the NCLEX and RN exam, get certified in the state in which you work. But being an RN, you also have to have the personality to be a registered nurse. You have to be kind, have sympathy for your patients, and care for others besides yourself. Next is the daily life of an RN. Your work environment consists of hospitals, which is fast-paced, clinics, which is consistent, schools, which is a slower pace. You kind of just wait until, students get ill or anything, or homes, which is a really slower pace because you're kind of focused on one person at a time, sometimes 2, 3. Your hours that you typically work ranges from 8-hour shifts to 12-hour shifts. It could be from Monday through Friday or in rotating weekends, or it could be part-time, full-time, or as needed, days, nights, weekends. It kind of just varies on like your location and, your level of degree. In all, RNs typically communicate with doctors, patients, licensed practical nurses, which are called LPNs, advanced practice registered nurses, and nurse practitioners. Wrapping it up, in conclusion, we have talked about what is an RN, what it takes to be an RN, and the daily life. After listening, I hope you have a little more care for those who care for you.